Welcome back to the Morning Blend. We know that first impressions are very important, and a nice, confident smile can do wonders to make that introduction go very smoothly. Dr. Robert Monteagudo is back from Wisconsin Smiles with 8 different ways to improve your smile. Great to see you.
It's always fun to be here.
A lot of people think, I personally think people think of braces and teeth whitening.
Yeah, actually, there's those are the 2 main ones that people think about, but there's so many other ways that you could actually improve your smile, and you don't have to go through braces or some of the other more extensive treatment, but we'll talk a little bit about that.
I like that. Let's go through the 8, starting with the fact that first impressions are really everything. Studies really show that nice smiles make a difference, right?
Yeah, they really do. Studies have shown that people that have a nice smile, they tend to be seen as more confident. They also, it's weird. They did a study where people that have nice smiles and have a better personality tend to be promoted more.
Oh, yeah.
So it's kind of the ultimate accessory. I mean, we could dress up real nice and stuff like that, but really your smile is your ultimate accessory.
Yeah, I get that. That's a great way to put it, I think. All right, so composite fillings, option number 1.
Yes, option number 1, composite fillings. Again, if you have the, in dentistry, we've used a lot of the silver fillings, okay? It's a white tooth, silver fillings. A lot of people really don't like that, so we could very easily remove those fillings and place white fillings, and it looks very nice and very natural.
It's beautiful. I mean, the after is a big difference. And you know, when we open our mouths, we laugh, we smile, we sing. I don't sing, but you know, you think people don't see that, but they do.
Yeah, actually, yeah, they do. So especially the people that are kind of boisterous, like, you know.
Like me?
Yeah, like you. But again, you're able to see those in people's mouths. I've seen actors, for example, in movies, they'll smile and you can see these really big black fillings in the mouth. It just doesn't look good.
I agree. Next, bonding.
Yes, bonding. So, for example, with bonding, we use it mostly on your front teeth. So, with bonding, we can close spaces, change the color of your tooth. If the tooth is slightly rotated, we could actually reshape it a little bit. Also, if you have a cavity on the front, on one of your front teeth, you don't want to put a silver filling in there. So, bonding works really, really well. It's usually done in 1 appointment. And patients come out just super happy with their new smile.
Oh, I bet. I think anything you can do to improve someone's smile makes them happy. What is enamel shaping and contouring? I'm not sure if I've heard that expression before.
Yes, enamel shaping and contouring. It's a very simple procedure. Sometimes you have one tooth that's just slightly longer than the other, it just has a little chip or slightly rotated. And we really don't need anesthetic for this. We just basically take the enamel, just reshape it a little bit. Okay. And in this case, what we did is that we just there were some corners that were a little higher than others. We just kind of evened everything out. And it's a very minimally invasive procedure, and it's done fairly quickly.
Yeah, and it might look like a slight change in that before and after to people, but I think it's something that really makes a difference again. Porcelain veneers are another option. Are those go on top of the teeth?
Yeah, again, with porcelain veneers, and we have a few examples here too. Basically, porcelain veneers are custom-made thin shells of porcelain that go right over the front of the tooth. Sometimes they'll overlap.
Look at that.
Yeah.
That's the same guy?
Yeah, that is the same guy. He's been a patient of ours for the last 10 or 15 years. Great transformation.
You recognize him by just that?
Yeah. I show that picture a lot. Again, in this particular case, he had a space. We tried bleaching his teeth. They wouldn't get any whiter. So using a porcelain veneer, we could actually cover. We can make teeth whiter. We could change the shape. We could just make it look so much more natural.
That's incredible.
Right now we have what are called non-prep veneers, and non-prep veneers are restorations that we really don't have to prepare the tooth. We can just place them right over the existing tooth structure without doing any preparations whatsoever.
When you say preparation, because sometimes they sand down or...
Yeah, sometimes you do have to remove a little bit of the enamel to be able to place the restoration, especially if the tooth is really rotated. So, so again, non-prep veneers work great because we don't have to do any of that stuff.
Okay, crowns. What's new with crowns?
Well, the thing is, we've all seen that person that when they smile, they have that crown, and usually crowns would have metal underneath them. And now we have all porcelain restorations, or all porcelain crowns. Some really beautiful restorations made out of zirconia. This is a case where they had the old type of a crown where they had metal underneath, and they have to put an opaquer over the metal, so you don't see that grayish look.
Yeah.
And so really there's really not a good reflection of light. So when we do use porcelain, light just goes right through the restoration, makes it look so much more natural.
Okay. Yeah, those are gorgeous set of teeth. Dental implants, that's a permanent fix if you have missing teeth, right?
Yeah, we've talked about that in previous shows. Let's say, for example, you're missing a front tooth and the two teeth on the sides don't have any restorations whatsoever. They're in a good position. Well, then why have to sand them down, like you said, to be able to place a bridge? Well, let's place an implant in that area. And again, now we have zirconia. Well, the implant's really made out of metal, but what goes over the implant to place a crown is made out of zirconia. So we can make them look very, very natural. And they just look drop dead gorgeous.
I think so too in that picture. Teeth whitening.
Yes, teeth whitening. We all know about teeth whitening. We have, you know, you could get teeth whitening at Walgreens and that, and so there are different types. Custom teeth whitening at a dental office, extremely safe, and it's custom made for that particular patient.
Okay.
One of the problems that we have with the teeth whitening systems that you could get at Walgreens, for example, they'll only whiten a few teeth, let's say from canine to canine or bicuspid to bicuspid. Yeah. So you have white teeth in the front, and then when you look at the person, like the back, all their back teeth are yellow. All right. So when we do it in an office, or you get it done at a dental practice or dental office, basically, again, we do all of the teeth, and the results are so much better.
All right, we ran out of time really quick. I want to mention orthodontics, braces, and Invisalign, because that's new, and that's a great way to change the shape, like braces do, in a way that is not so noticeable to everybody.
Exactly. We have quite a few patients, especially our adult patients, that use the Invisalign. Again, they're clear aligners. Change them out every 2 weeks. They do a great job.
That's awesome. You can actually move the teeth.
Yes. Huh? Yep.
That's great. And you're wearing an appliance that's removable.
So you really just take them off to eat and brush your teeth.
I love that. And right now, people, the first 25 callers can get in and get a free smile. I love the smile enhancement. You can get a smile consultation. Doesn't that sound great? I need that. What you need to do, though, is be one of the first 25 to call. The number is 414-982-3676. You can go to wisconsinsmiles.com to find out more. I love it. It's great. Have a great smile. You can have it. It's possible. Nice to see you.